We're soft launching the National Frailty Index. What does that mean? It means that we're just talking about what we're doing with some other local authorities around the country to see if there's any others who'd like to join us. What follows is a short presentation that runs through what it is, how it works, and what you can do to get involved. Imagine a future where you could prevent falls based on having an accurate sense of where frail people were living in order to make preventative intervention. What we've done is the first step of making that a reality by using national level data, processing it, analysing it, and looking at insights within it. We know it's a wicked problem, with £4.4 billion being spent system-wide every year. But we also know it's a tremendous human cost, with comorbidities increasing after a fall, triggers of other conditions such as dementia, an increased risk of mortality of as much as 30% following a first fall, and also the very real and often risk of a second fall. So, please join us in trying to create a safer, healthier future for the frailest in society. Frailty and falls is a wicked problem. We know that every day there's about 8,500 falls, and we know annually these cost £4.4 billion a year system-wide in the UK, with an estimated £1.1 billion within the adult social care system alone. It is a complex and very kind of system-wide issue that can be tackled in a range of ways. There are interventions across different systems at different times, and also there's intricate, complex, and often outdated or siloed data environments. The impact of a fall is catastrophic personally. It can lead to increased dependence, longer-term healthcare problems, risk of mortality, triggers of comorbidities, and the opportunity to solve this problem is huge in terms of the human increasing quality of life and prevention of falls. It literally saves lives. From a financial point of view, we've baselined ROI at a minimum of 2,000%. This is very cost-effective work that can have tremendous impact. So how are we doing it? We're looking at these three main columns and these three main layers. What we're saying is that there's population and data out there. So there's national data sets that we can break down to the neighbourhood level. We're saying that there are people out there, experts out there who have looked into this before and have great insight. We also look at prevention. What can we do to make that intervention to prevent the fall? And the extra value add that we add and freely give away is the neighbourhood level analysis that gives everyone the opportunity to look at their local authority area and see which areas there have the most frail people within. So the final piece that we're looking at is a local offer. We would love to work with trailblazing local authorities who would like to use the data that they have in-house to build a household level model that can be built up to the neighbourhood level to help us validate the national model, but also give them exact doors to knock on to make proactive preventative interventions. The first persona that we're looking at is the persona most likely to fall, and this is based on the work of our initial steering group of people who've been working in frailty and falling in the adult social care and health systems. But this only goes part of the way. This is a bit dry. So we started thinking about Margaret, someone who's a 71-year-old widow. By building this persona together, we then started looking within the data sets where we could find expressions that would map against this as a first step. The first map that we came to was very top level and of limited use. The National Frailty Index can be looked at a very high national level. The National Frailty Index goes from a very top level view into something more granular when you begin looking at the neighbourhood level. all of a sudden you can see that it comes alive, and there are very specific hotspots and areas within each local authority where there are greater numbers of frail people living. When you take it to the next level, and here's an example of a section of a local authority, you can begin to see areas where the darker purple circles indicate higher levels of frail people living. This is perfect for public health interventions. So where are we now? The National Frailty Index is free and ready. We have neighbourhood level frailty data for your local authority right now. This allows you to target interventions precisely, optimise resource allocation, and measure impact effectively. We would like to give it to you, and in return, we would ask for two things. First off, feedback, so we can further improve the model when we share with other local authorities going forward in the future. We would also ask you to consider the National Frailty Index local offer. That's using your data in-house on a commercial basis to help sustain the entire project, but also give you household level information and intelligence that you can use. It is a win-win collaboration. That custom household level frailty prediction model will be invaluable for your local authority. It will also allow you to explore other comorbidities, finding other preventative measures. It takes it from a public health response to a personalised preventative response. It will contribute to the national model and therefore cumulatively improve how we can help frail people across the country. It's also incredibly cost effective. Our calculations show that if we could just prevent one fall a month per local authority, we would save each local authority £500,000 in adult social care costs. And with a fixed price model, that means your return on investment would be 2,000%. But most importantly, there would be a significant reduction in the human cost being paid by those who fall. We've started with one fall a month, but what would a 10% reduction mean for your local authority and the residents in your area? We really do believe passionately this is a win-win collaboration that will allow us to truly shift the needle on what is a national problem. So, next steps, please get in touch and we'll be more than happy to run through the data for your local authority and send it across to the appropriate people. We'd also enjoy the opportunity to explain how the local intervention work can be done quickly and see if you're interested in that. The National Frailty Index, we do believe that we can begin to make meaningful interventions to prevent falls across the country within a matter of months. Please get involved.